Did you know that something sitting right in your medicine cabinet might be making your balance worse? Hi, welcome back to Senior Balance Hub, and today we are talking about something most doctors don't have time to explain: the hidden connection between common medications and balance problems. If you've been taking the same pills for years and suddenly noticed you feel less steady on your feet, this video might change everything. We are going to look at which medications can affect your balance, why this happens, and most importantly, what you can do about it. But first, let me ask you something. Have you ever felt dizzy or unsteady after taking your morning pills? Or maybe you've noticed you're more wobbly at certain times of the day. If so, you're not alone. Studies show that medication side effects cause thousands of falls in seniors every year. The scary part? Many people don't realize their medications might be the problem. Before we dive in, let's talk about why your doctor might not bring this up during your appointments. It's not because they don't care. Most doctors only have 15 to 20 minutes with each patient. They're focused on treating your main health problems. They might not have time to go through every possible side effect of every pill you take. Plus, many balance problems develop slowly. You might not even notice the change at first. By the time you do, you might not connect it to a medication you started months ago. That's why it's so important for you to know this information yourself. Let's start with the big ones. These are medications that millions of seniors take every day, often without knowing they might affect balance. If you take pills for high blood pressure, pay attention to this section. These medications work by changing how your blood flows through your body. Sometimes, this can make you feel dizzy or lightheaded. The most common problem happens when you stand up quickly. Your blood pressure might drop for a moment, making you feel unsteady. This is called orthostatic hypertension, but you can just think of it as standing up too fast dizziness. Some blood pressure medications are more likely to cause this than others. Water pills, also called diuretics, can be especially tricky. They make you lose water and salt, which can affect your balance. Beta blockers are another type that might make you feel dizzy. These pills slow down your heart rate, which is good for your heart but might make you feel less energetic or steady. ACE inhibitors can also cause dizziness, especially when you first start taking them or when your doctor increases the dose. Here's what you can do. Stand up slowly. Take your time getting out of bed or up from a chair. Give your body a few seconds to adjust. This might surprise you, but sleep medications can affect your balance the next day. Even if you feel wide awake in the morning, these drugs might still be in your system. Prescription sleep pills like Ambien, Lunesta, and others can make you feel groggy or unsteady for hours after you wake up. Some people call this a hangover effect. Over-the-counter sleep aids can do this too. Many of these contain diphenhydramine, which is the same ingredient in Benadryl. This drug can stay in your system for a long time, especially as you get older. The problem gets worse if you get up during the night to use the bathroom. You might feel more confused or unsteady than usual. Here's what helps. If possible, try to get a full night's sleep when you take these medications. Avoid getting up quickly in the middle of the night. Keep a light on in your bedroom so you can see where you're going. Many seniors take medications for anxiety or depression. While these drugs can be very helpful for your mental health, some of them can affect your balance. Benzodiazepines are anxiety medications like Xanax, Ativan, and Valium. These drugs slow down your nervous system, which can make you feel calm but also less coordinated. Some antidepressants can cause dizziness too. This is especially true when you first start taking them or when your dose is changed. The tricky thing about these medications is that they can build up in your system over time. You might not notice balance problems right away. What can help? Be extra careful when walking, especially on stairs or uneven surfaces. Don't rush when you're moving around. If you feel dizzy, sit down until it passes. If you take pain pills, especially strong ones, they might be affecting your balance more than you realize. Opioid pain medications like oxycodone, morphine, and others can make you feel dizzy or confused. They can also slow down your reflexes, making it harder to catch yourself if you start to fall. Even some over-the-counter pain medications can be a problem. If you take several different pain pills throughout the day, they might add up to cause balance issues. Muscle relaxants are another type of pain medication that can make you unsteady. These are designed to make your muscles less tense, but they can also make your whole body feel less coordinated. Safety tips: never take more pain medication than prescribed. Don't mix different types of pain pills without asking your doctor first. Be extra careful walking for a few hours after taking strong pain medication. You might not think of allergy pills as affecting your balance, but some of them definitely can. Older allergy medications, especially those that make you drowsy, can cause balance problems. Even if you don't feel sleepy, these drugs might still be affecting your coordination. Some people take allergy medications every day, all year round. Over time, your body might get used to feeling slightly off balance, so you don't even notice it anymore. The good news is that newer allergy medications are less likely to cause these problems. But if you're taking an older type, it might be worth asking your doctor about switching. Many seniors take medications to help with bladder control. These drugs can sometimes cause dizziness or confusion, especially in older adults. The problem is that these medications affect your nervous system. They're designed to calm down your bladder, but they might also affect other parts of your body. If you take these medications, be aware that you might feel less steady, especially when you first wake up or after sitting for a long time. You might wonder why medications seem to affect your balance more now than they did when you were younger. There are several reasons for this. First, your body processes medications differently as you age. Your liver and kidneys don't work as efficiently as they used to. This means drugs stay in your system longer than they did when you were younger. Second, you're probably taking more medications now than you did when you were younger. Each additional drug increases the chance of side effects and interactions. Third, your balance system naturally gets weaker as you age. So even a small effect from medication can make a bigger difference in how steady you feel. Finally, seniors often take multiple medications that can all affect balance. When you add up all these small effects, they can create a big problem. Sometimes, taking just one medication might not cause balance problems. But when you combine certain drugs, the effects can add up in dangerous ways. For example, taking a blood pressure medication plus a sleep aid might make you much more likely to feel dizzy when you stand up. Or combining an anxiety medication with an allergy pill might make you feel more confused or unsteady than either drug would alone. Pain medications plus muscle relaxants can be especially dangerous. Both types of drugs can make you feel drowsy and uncoordinated. Together, they might significantly increase your risk of falling. Even over-the-counter medications can be part of dangerous combinations. If you take several different pills from the drugstore, plus your prescription medications, you might be creating balance problems without realizing it. Don't forget about the pills you buy at the drugstore. Just because you don't need a prescription doesn't mean these drugs can't affect your balance. Sleep aids from the drugstore often contain diphenhydramine. This drug can make you feel groggy and unsteady, sometimes for many hours after you take it. Cold and flu medications often contain several different drugs. Some of these can make you drowsy or dizzy. If you're already taking prescription medications, adding cold medicine might push you over the edge into balance problems. Pain relievers like ibuprofen or naproxen usually don't directly affect balance. But if you take them regularly, they can interact with other medications you're taking. Even vitamins and supplements can sometimes cause problems. For example, too much vitamin D can make you feel weak or confused. Some herbal supplements can interact with your prescription medications. The key is to remember that everything you put in your body can potentially affect how you feel and how steady you are on your feet. Now, how do you know if your medications are causing balance problems? Here are some signs to watch for. Do you feel dizzier or less steady at certain times of the day? Many people notice problems about 30 minutes to 2 hours after taking their medications. This is usually when the drugs are at their strongest levels in your body. Do you feel more unsteady when you first wake up? This might mean that medications from the night before are still affecting you. Have you noticed balance problems that started around the same time you began a new medication? This is often the biggest clue that a drug might be the problem. Do you feel more confused or foggy at certain times? Mental confusion often goes hand in hand with balance problems. Have you had any close calls with falling, especially at predictable times of day? If you always feel unsteady after taking your morning pills, that's worth paying attention to. If you think your medications might be affecting your balance, here's what you should do. First, don't stop taking your medications on your own. Many prescription drugs need to be stopped gradually, and some are too important for your health to stop suddenly. Instead, start keeping a simple diary. Write down what medications you take and when you take them. Also note when you feel dizzy, unsteady, or confused. After a week or two, you might start to see patterns. Next, make an appointment with your doctor or pharmacist. Bring your medication diary with you. Also bring all your medications, including over-the-counter drugs, vitamins, and supplements. Your doctor might be able to adjust the timing of your medications. Sometimes, taking a drug at a different time of day can reduce side effects. Your doctor might also be able to switch you to a different medication that's less likely to affect your balance. Many health conditions can be treated with several different drugs, and some are better than others for seniors. In some cases, your doctor might be able to reduce your dose. Sometimes, a lower dose is just as effective but causes fewer side effects. When you talk to your doctor about this issue, here are some good questions to ask. Could any of my medications be affecting my balance? This is the most important question. It opens up the conversation and shows that you're aware this might be an issue. Are there alternatives to any of these medications that might be less likely to cause dizziness? Your doctor might know of newer drugs that have fewer balance-related side effects. Can we adjust the timing of when I take these medications? Sometimes, spreading out your doses throughout the day can help. Or taking certain medications at bedtime instead of in the morning might reduce daytime dizziness. Do any of my medications interact with each other in ways that might affect my balance? Your doctor can use computer programs to check for drug interactions that you might not be aware of. Should I be taking all of these medications, or are some of them optional? As you age, your health needs change. Some medications you started years ago might not be necessary anymore. Don't forget about your pharmacist. Pharmacists often know more about drug side effects and interactions than busy doctors do. Most pharmacies can do a medication review for you. This is where the pharmacist goes through all your medications and looks for potential problems. Your pharmacist can also help you understand when to take each medication for the best results and fewest side effects. If you use multiple pharmacies, try to get all your prescriptions filled at the same place. This makes it easier for your pharmacist to catch potential problems. While you're working with your healthcare team to address medication issues, there are things you can do right now to stay safer. Stand up slowly, especially first thing in the morning. Give yourself a few seconds to feel steady before you start walking. Keep your bedroom and bathroom well lit. Many balance-related falls happen when people get up at night. Remove loose rugs and clutter from your walking paths. If medication is making you slightly less steady, you don't want additional tripping hazards. Consider using a walking stick or cane if you feel unsteady. There's no shame in using tools that help keep you safe. Stay hydrated, especially if you take water pills. Dehydration can make balance problems worse. Don't rush. Give yourself extra time to get places so you don't feel pressured to move quickly. One of the best things you can do is to have regular medication reviews with your healthcare team. This should happen at least once a year, and more often if you're having problems. During a medication review, you and your healthcare provider go through every single thing you take. This includes prescription drugs, over-the-counter medications, vitamins, supplements, and even herbal teas. You discuss whether each medication is still necessary, whether the dose is right, and whether there might be better alternatives. This is especially important as you age because your health needs change. A medication that was perfect for you 5 years ago might not be the best choice now. It's also important because new medications become available all the time. There might be newer drugs that work just as well as what you're taking now, but with fewer side effects. As you work on addressing medication-related balance issues, it's important to listen to your body. You know yourself better than anyone else. If you feel dizzy or unsteady, don't ignore it. Sit down until the feeling passes. Don't try to push through balance problems. Pay attention to patterns. Do you always feel dizzy around the same time each day? This information can be very helpful for your healthcare team. Don't be afraid to speak up. If a medication is making you feel unsteady, that's important information. Your doctor needs to know about side effects to help you properly. Remember that balance problems can be subtle. You might not feel dramatically dizzy, but you might notice that you're holding onto railings more often, or that you feel less confident walking on uneven surfaces. Here's the encouraging part of this story. Most medication-related balance problems can be improved. Sometimes, a simple change in timing is all that's needed. Taking a medication at bedtime instead of in the morning might solve the problem completely. Other times, switching to a different drug in the same family can make a huge difference. Newer medications often have fewer side effects than older ones. In some cases, you might be able to reduce your dose or even stop a medication entirely, especially if your health has improved since you started taking it. The key is working with your healthcare team to find solutions that keep you healthy while minimizing balance problems. If your doctor does make changes to your medications, be extra careful for the first few weeks. Your body needs time to adjust to any changes. Don't make multiple medication changes at once if you can avoid it. It's better to change one thing at a time so you can tell what's helping and what isn't. Keep that medication diary going even after you make changes. This will help you and your doctor figure out if the changes are working. Don't be discouraged if the first change doesn't solve the problem completely. Sometimes it takes a few tries to find the right combination of medications and timing. While we are focused on medications today, remember that they're just one piece of the balance puzzle. Regular exercise, good nutrition, and staying hydrated all play important roles in keeping you steady on your feet. The balance exercises we've talked about in other videos become even more important if you're dealing with medication side effects. Strong leg muscles and good balance skills can help compensate for medication-related dizziness. Getting enough sleep is also crucial. If medication side effects are disrupting your sleep, that can make balance problems worse. The most important message I want you to take from this video is that you have more control than you might think. Medication-related balance problems are common, but they're not something you just have to live with. Start by becoming more aware of how your medications might be affecting you. Keep that simple diary for a week or two. Notice patterns in how you feel throughout the day. Then, have an honest conversation with your healthcare team. Bring your diary, bring all your medications, and don't be afraid to ask questions. Remember, your doctors and pharmacists want to help you feel your best. They need your input to do that effectively. Here's what I want you to do after watching this video. First, gather up all your medications. That includes prescriptions, over-the-counter drugs, vitamins, and supplements. Put them all in one place so you can see everything you're taking. Second, start keeping a simple medication and symptoms diary. Write down what you take and when, and note any times you feel dizzy, unsteady, or confused. Third, schedule an appointment with your doctor or pharmacist for a medication review. Bring your diary and all your medications. Fourth, be patient with the process. Finding the right balance of medications that keep you healthy without affecting your stability might take some time. And remember, small changes can make a big difference. You don't have to feel unsteady or dizzy all the time. There are solutions out there. If this video has been helpful, please give it a thumbs up and subscribe to Senior Balance Hub for more information about staying steady and safe as you age. Do you have questions about specific medications and balance? Leave them in the comments below. While I can't give personal medical advice, I can make videos addressing common concerns. And remember, you're not alone in dealing with these issues. Millions of seniors face similar challenges. The good news is that with the right information and support from your healthcare team, most balance problems related to medications can be improved. Take care of yourself, and I'll see you in the next video where we'll be talking about how to make your home safer if you're dealing with balance challenges. Stay steady, stay safe, and keep learning about your health. You've got this.